Hello, welcome to our workshop, Helping Your Child Cope with Grief. I'm Angela Wilson, and I'm a family success coach with Infant Child Enrichment Services. I hope you get a lot of value out of this workshop. Coping with the loss of a loved one, whether it's a grandparent, parent, classmate, or even a cherished family pet, can be a challenging and deeply personal experience for each child. Parents and caregivers seeking ways to support grieving children will discover valuable insights in this workshop. This workshop, informed by child and adolescent grief experts, offers age-appropriate advice on what to say, who should say it, key signs to look for, and practical tips for providing support. Everyone handles death and grief in unique ways. If you have multiple children, you may notice that their ways of expressing emotions vary greatly, influenced by their individual personalities and developmental stages. Children grieve differently from adults. Young children may not fully grasp the concept of death or the permanence of loss, sometimes worrying that they caused the death. They might show little concern at times or switch from tears to play in a moment. It's also common for them to feel anger towards the person who died or even someone else. As they grow older, they begin to understand more, but still need guidance from parents and caregivers to process and cope with their feelings. Supporting children through grief can be challenging, especially when you're grieving too. Though you cannot shield them from loss and its associated pain, you can significantly help them feel secure and manage their grief in a healthy way. Who should tell the child? Whenever possible, the person closest to the child should deliver the sad news, even if that person is also grieving, like a parent. It's acceptable for the person sharing the news to be sad or crying, but they should maintain enough emotional control to avoid alarming the child further in an already distressing situation. If the grieving parent is too upset to calmly deliver the news, the next closest person to the child should step in to break the news. There is no perfect time to break the news, so it's best to inform children as soon as possible, within reason. If it's only a few hours until the end of the school day, waiting until then is acceptable. The main concern is ensuring your child doesn't hear the news unexpectedly from another source, or walk into a situation where adults are visibly upset, which could be frightening. Choose a thoughtful setting for the conversation. You'll want a place where your child can freely express their emotions, likely not a public place, although you might want to soften the blow by sharing the news in a happy setting like a favorite ice cream parlor. Understand that a treat won't lessen the sadness. Use clear, direct language and be ready to give a brief explanation of how or why the death occurred, as children are naturally curious. However, you don't need to go into great detail. Start with minimal information and add more based on the questions. Keep explanations short, simple, and direct, while ensuring the conversation is calm and compassionate. The words you use will depend on your child's age and developmental stage, but there are some expert recommended guidelines that can help, no matter the child's age. Follow their lead. Children's questions and concerns can differ greatly from those of adults. Giving too much information at once can overwhelm them. It's better to let them ask questions and then answer in a way that is appropriate for their developmental stage. Young children may seem self-centered, which is a normal part of their development. Encourage expression of feeling. Don't try to protect or shelter children by hiding your own sadness. They will sense that something is wrong and feel isolated and confused. Hiding your grief can make them think their own sadness is wrong. However, avoid letting children see you in moments of extreme upset, as this may cause them to worry or feel insecure. Maintain normal routines. While grief takes time, children benefit from the security of regular routines and the knowledge that life goes on. Memorialize the deceased. Remembering is a key part of grieving and healing. Share memories of the deceased and mention their names so your child knows it's okay to talk about and remember them. Keeping photos around can also help. For many children, especially young ones, losing a family pet can feel like losing a lifelong friend. And it might be their first encounter with death. Be open and honest if the death happens unexpectedly. If your pet is suffering from an illness and needs to be euthanized, reassure your child that the vet did everything possible, but the pet was too sick to recover. Avoid using vague and confusing phrases like put down. Telling children that the pet has been put to sleep can make them develop a fear of going to sleep. The death of a grandparent is often a child's first experience with the loss of a human life and the grieving process. If your children have lost a grandparent, you can reassure them by explaining that most people do not die until they are very old, which may help alleviate any fears they may have about their own mortality or yours. If the deceased relative was younger, such as an aunt or uncle, explain that they had an illness or were involved in an accident that is not common among younger people. Death of a parent. Such a loss is particularly difficult and traumatic for a child of any age to understand and handle. The surviving parent is likely to be very upset, and it's okay to show sadness. However, choose a time when you can share the news without being overwhelmed by emotions. Use age-appropriate language to explain the death, and reassure children that they will still be cared for. In the event of a parent's death, professional counseling is often beneficial for children regardless of their age. If you are a parent or a caregiver, keep children informed about their parents' health to avoid surprises and prevent them from wondering and worrying about being there when their parent dies. If possible, schedule one-on-one time for activities like reading, playing cards, or simply talking with their sick parent, so they have good memories of their time together towards the end of their parent's life. The death of a child, whether from an accident or illness, is profoundly unexpected and difficult. Such a loss often raises questions from surviving siblings about their own safety. Parents grieving the loss of a child may be inconsolable, but it's crucial to reassure your other children that they are safe and that you will be there for them. Allow them to ask questions and understand that they move in and out of grief for many months, while you may feel the loss continuously. Don't hesitate to seek additional support from other adult caregivers such as grandparents, aunts, or friends. A traumatic death is especially difficult to discuss, but children will naturally be curious about how their loved one died, and it's important not to avoid giving an explanation. Provide developmentally appropriate information without overwhelming them. For example, you might explain that the person had a disease that caused their brain to stop functioning correctly, and despite the doctor's efforts, they couldn't cure the disease. As children grow older, you can offer more details. If the loved one died from an overdose, you can explain that the disease was addiction, which caused a person to seek more of a substance than was good for them. For teenagers, you can identify the specific substance and reassure them that the addiction did not make their loved one bad. Explain that while addiction can run in families, it is a complex disease influenced by both genetics and the environment. Having a relative with addiction does not mean they will inevitably face the same struggle. If the loved one died by suicide, you can explain that they had a mental health disorder, which is a disease of the brain, and it caused their death. Provide older children with more information if they ask for it, but avoid sharing distressing details. Reassure them that their remaining caregivers are healthy and will take care of them. Understand that children will process this loss over many years as their understanding evolves with age. Dealing with such a difficult and traumatic loss may very well require professional help. Who else should be informed? It's essential to inform the people your child spends time with if there has been a significant loss. This includes teachers, school counselors, coaches, after-school program directors, and other family members. Keep in mind that while you can notify the school staff, their awareness may only last a week or two. If the loss is significant, like the death of a parent, your child will be dealing with it throughout the year, so you may need to regularly check in and remind them. If your child is younger, it's also important to inform the parents of their close friends. For middle or high school age children, ask if they want to tell their friends' parents themselves or if they would prefer that you do it. Is it okay to give alone time? This depends on the child's age and personality. Younger children often move in and out of grieving, so it's okay to let them play alone as long as you stay nearby in case they need support. Keep playdates shorter and at your home so you can monitor them closely. For teens, alone time after receiving the news is generally appropriate if they desire it. With both teens and younger children, it's important to ask open-ended questions like, "What do you think?" or "How are you feeling?" Let them know that processing this will take time, and reassure them they can always come to you with questions or to talk about their loved one who has passed. When a death occurs around a holiday, it's unrealistic to expect a happy celebration. While there may be moments of happiness, everyone will likely be preoccupied with the loss, and it's important not to force your child to hide their grief. Still acknowledge important occasions like a child's birthday or graduation, as ignoring them could be equally painful. If the deceased was close to you, the year will be filled with firsts without them. Celebrations such as the first Thanksgiving, birthday, Christmas, or Hanukkah without that person will be challenging. Try to maintain traditions as much as possible, but be mindful that you and your child will likely experience a mix of joy and sorrow. Funerals, wakes, and memorial services play a significant role in the grieving process, serving as a way to say goodbye to the deceased. When it comes to deciding whether a child should attend a funeral, there is no right or wrong answer. Children should never be forced to attend. If they express a desire to go, they should be encouraged. For younger children, consider bringing a trusted babysitter or someone they feel comfortable with who can leave with the child if they decide they've had enough before the service ends. Prepare your child for what they will see. Explain that people may be dressed in dark colors and many will be very sad and some might be crying. Inform them if there will be a casket with the body and any other important details. What to expect with babies and toddlers. Babies and toddlers don't understand the concept of death. However, they do notice changes in their environment and can sense distress. At this age, children generally cannot use language to ask questions or communicate their feelings. Grief in babies and toddlers may show up as increased crying, irritability, and clinginess, looking for the person who has died, anxiety around strangers, less interest in play or food, and regression. How you can help. Provide physical comfort and affection by holding and cuddling them. Speak calmly around them. Offer familiar comforts such as a favorite blanket and stuffed animals. Maintain consistent caregivers wherever possible. What to expect with kids ages 2 to 4. At this age, children lack a real understanding of death and are generally unable to comprehend its permanence. They are very present-oriented and don't understand that death means forever. They may ask the same questions repeatedly. Be patient, consistent, and reassuring. A grieving child in this age group may exhibit a series of brief but intense responses. Possible expressions of grief could be regression to earlier behaviors like thumb sucking and bedwetting, sleep problems, irritability, and confusion. How you can help. Provide honest, direct, brief answers to their questions and offer lots of reassurance and affection. Maintain a consistent routine. Encourage play as it serves as an outlet for their grief. What to expect with kids age 4 to 7. Children in this age group may still perceive death as reversible and may engage in magical thinking, believing they somehow caused the death. They tend to ask concrete questions like how did he die and what will happen to him now. Possible expressions of grief could include nightmares, regression to earlier behaviors, changes in sleeping and eating habits, violent play, and attempting to take the role of the deceased. How can you help? Encourage them to express their feelings through physical activities and symbolic play, such as drawing and storytelling. Talk openly about the person who died, providing reassurance and support. What to expect with kids ages 7 to 13. Children in this age group have more mature and logical thinking. While they may still hope that death is reversible, they're beginning to understand its finality. School-age children often ask specific questions and seek detailed information. They may be concerned about how others are reacting to the death and want to know the right way to respond. They're starting to develop the ability to mourn and recognize mourning in others. Despite their logical thinking, children in this age range may become overly fearful of sickness and injury because they don't fully understand the mechanisms of death. They may also fixate on why someone died, especially if it conflicts with their sense of right and wrong. In these cases, help them develop an explanation that makes sense to them. As they grow older, they will understand the loss in a more mature, nuanced way. Possible expressions of grief may include regression, school problems, withdrawal from friends, acting out, changes in eating and sleeping habits, overwhelming concerns about their own health, and thoughts about their own mortality. How you can help. Encourage the expression of feelings no matter what they are. Explain options and allow choices around funerals and memorial services. Be present, but also allow for a long time. Encourage physical activities as an outlet. Don't avoid discussing the death or answering questions. What to expect with kids ages 13 to 18. Teenagers have the ability for abstract thought and a more mature understanding of death. Possible expressions of grief: extreme sadness, denial, regression, risk-taking behavior, preference for talking to peers or others outside the family, depression, anxiety, acting out, and possible suicidal thoughts. How you can help. Encourage them to talk, whether it's to you, friends, teachers, or a therapist. Avoid trying to make it all better or dismissing their grief. Allow them to mourn in their own way. Be available, but respect their need for personal space. If a child becomes overwhelmed with emotions or starts acting aggressively, it's okay to stop the activity. Be kind but firm. You might say, "We're going to stop here. We might come back to this, but for now I want to make sure you're safe. It looks like you're really upset right now. Let's figure out together what will help you manage this big feeling." Our goal is to help children release big feelings safely. They might kick or throw a ball outside, bang on a drum, run, stomp, or dance. Every child expresses themselves differently. Whenever possible, offer options and let the child choose what might help them the most. When kids feel overwhelmed or out of control, engaging their five senses can help them tune in to the present moment and tune out overstimulating input from the outside, or turn down the intensity of their own thoughts. Whether together or one-on-one, encourage children to name 5 things they can see, 4 things they can hear, 3 things they can touch, 2 things they can smell, and 1 thing they can taste. Remind children that it's normal to have big feelings or difficult thoughts, but they don't have to be stuck in those emotions. Our bodies can help remind us that we are safe and secure. When should you get professional help? Grieving is a natural process and takes time. However, symptoms that persist beyond 6 months or are significantly impairing may indicate that your child needs professional help to cope with their grief. Here are some signs that professional help might be necessary. Nightmares, belief that the world is generally unsafe, irritability, anger, and moodiness, poor concentration, appetite or sleep disturbances, ongoing behavior problems, persistent regression to earlier behaviors in young children, such as cleaning, bedwetting, or thumb sucking, difficulty sleeping, detachment or withdrawal from others, use of alcohol or drugs in teens, inability or refusal to go to school, learn, or play with friends, anxiety, ongoing depression, suicidal thoughts. If you observe any of these signs, it might be time to seek professional help to support your child's emotional well-being. While your first instinct may be to protect and comfort your children, it's essential to seek help for your own grief as well. If you're parenting or supporting a grieving child, one of the best ways to help is by ensuring that you take care of yourself too. Find reliable sources of support. Research shows that the child's well-being after a death is closely linked to how well the adults in their life are coping. This doesn't mean hiding your grief from your child. Instead, it means making sure you have people and activities in your life that provide comfort. If you need help or a break to clear your head, prioritize asking for it. By accessing support, you demonstrate to your children how to take care of themselves and reassure them that you have the energy and presence to be there for them. Be prepared to accept help from friends, relatives, and possibly mental health professionals. That's the end of our workshop. Thank you so much for watching, and I hope that you got some valuable insights out of this workshop.